And then the testimonial, I weightlift quite a bit, and I hurt my back quite a while ago, and I went to a chiropractor before I actually knew Dr. Mike, and the guy adjusted me, walked out of there with the same pain I had, didn't feel like he had done anything. Went to Dr. Mike because I was having pain later on. I walked out of there, I felt like $1 million.
Show, baby.
You know,
what are you talking about? Dr. Mike from Main Place Chiropractic, and I want to thank you in advance for letting me talk this morning. Who do you know has recurring pain in some part of their body? Well, those are great referrals for me. I'm going to tell you a couple success stories I had in the office. First one was a 14-year-old kid who has had neck and upper back pain for about 3 years. He had been to his primary doctor, been to the orthopedist, he's had an MRI of his neck and x-rays. And the bottom line for his treatment, his recommendations were take medications, they're growing pains. And obviously, you know, the parents didn't really like that idea, so they sent him in to try chiropractic. And I took x-rays of this, the kid's like 6 foot tall and 14 years old, and he carries his head forward. So we take x-rays of his neck, and instead of having a neck with a nice beautiful curve this way, he had a beautiful curve, but it was going the wrong way. And the problem is that when you carry your head forward like this, you have, you know, this 10-pound head being held up by all these muscles that are always in a state of contraction, which is, in my opinion, was causing his complaints. So I started him on treatment, and it wasn't just the typical chiropractic pop and some therapy, but we did directional traction and exercise. And the idea was to get his head pulled back over his center of gravity and help get a curve back in his neck with the traction. And the traction was done not only in the office, but at his house as well. And in 6 months, I took an x-ray, a post x-ray, and we had about 23 degrees of improvement. So we got his neck that was going 12 degrees forward to an 11-degree curve going the opposite way, which is the start. You need to have a 40-degree curve, textbook, but it was a great start, and it took 3 months before he was actually out of pain. So he was out of pain 3 months, but you got to keep working on it to get that, you know, to build the good posture again. But that's why I love what I do, because you get those kinds of results. Not in everybody, but it just makes you feel that you did something good. My second success story, I had a guy that he's 35 years old, and he has a history of chest pain, and he had been to the emergency room 3 times in a 2-year period complaining of chest pain. And when you go to the emergency room, generally, you know, they have to do a full cardiac workup on you. That's just part of the protocol. And every time it came back that he had, you know, his heart was fine, nothing's wrong. And they were essentially telling me that you have anxiety, and that's what's causing, you know, the symptoms. And he probably was having anxiety because he thought he was having a heart attack. But he went to an internal medicine doctor, and sure enough, his blood pressure elevated, and he had high cholesterol. So he's like, this guy's worried. You know, he's worried, and he thinks that he's just a ticking time bomb. And so he tries chiropractic to see, you know, what we can do. And I took x-rays of his neck and his back, and didn't really see a whole lot. But we did an MRI of his mid-back, and he had a huge disc herniation that was putting pressure on a nerve that was referring pain into his chest area. So, you know, and just him knowing, you know, I assured him that that's what it was. And just him knowing, it just calmed him down. It just made him like, oh, this is great, you know. Even though it's not fixed, because disc herniations, you can't cure a disc herniation. And that's what I wanted to talk about today, is about disc herniations. And as you know, disc herniations are also known as disc bulges or disc protrusions. There's different names. And I'm sure everyone knows someone with a disc herniation, right? Well, you all know me. I have 4 of them, so you all know someone. But I wanted to talk about a little bit about the mechanics of it. This is a picture of, if you were to look down at a disc, like if I was to cut axial and look down, it looks like a jelly donut. And the center of it is the nucleus. And if you look at a side view of the disc, it's made up of a cross matrix of cartilage fibers, which surround the perimeter and kind of hold the contents in the center. And what happens is when some of these fibers get disrupted, it creates a weakening in the wall, and allows the nucleus, the jelly, to kind of bulge through out that weakened area. And people get weakened walls for several reasons. Either you have trauma, which can break the disc, break some of these annular fibers, or it could be repetitive, an overuse, which is a form of trauma. But most of the time, it's because the discs get dehydrated. They lose their moisture. And they lose moisture because of either overwork or there's not enough good motion, not enough motion in the joint. So when joints get locked up and there's not motion in that joint for a long time, there's no reason for it to have the hydration and the flexibility, so it kind of loses its moisture. These fibers get brittle, and then you're more susceptible to having cracking, herniation, or more susceptible to an injury. And the way they measure these disc herniations, if you've read an MRI report, it might say you have a 2 to 3 millimeter disc bulge at L2, L3. So like a 1 to 2 millimeter bulge, and it's the distance from the outside of the disc to the outside of where the herniation is. If it's 1 to 2 millimeters, they would consider that a mild herniation. If it's 3 to 4 millimeters, they would consider that moderate, and 5 millimeters or more would be considered a severe disc herniation, and it may require surgery. I mean, you never do surgery based on numbers, but it's really based on your pain and your function, because I've had patients with 2 and 3 millimeter bulges end up getting surgery because they just couldn't get out of pain. But disc herniations can respond great with chiropractic treatment. However, some do not. Some don't respond at all, and some get worse, because if you adjust a disc herniation, some people just fly off the table if they just don't like it. But the idea behind the treatment of a disc herniation is not to cure it, but to manage it. And the way you manage it is you want to mobilize or adjust the areas above and below the herniation so that you can kind of even out the stresses, so that one area is not working so hard. And to even out the stresses gives that disc time to actually heal. Some of the treatments that we use, chiropractors use, and the medical profession uses in general is, from a conservative standpoint, is decompression, which is opening up the space to suck the nucleus back in the center. They have these decompression tables. We don't have these at our office, but they're, you lay down on it and they harness your torso and your pelvis, and you lay down and you plug in the patient's weight and their height and all that, and it opens up, it separates, and then it relaxes, and separates and relaxes, and it helps milk that nucleus back in. Some of the treatments that we use in our office, we use the Cox flexion table. Some people have been on in here that have been on that table, where you lay on your stomach and you hold on to these bars, and then we kind of tie your legs down and we traction up with our palm on the segment above the disc, and the leg piece kind of moves up and down, so you're just kind of opening up the disc. So it's just spreading open and shutting repetitively to help milk that nucleus manually back central. And we use the roller tables, which is like, they call it intersegmental traction. Just brings extension into the spine. It's a form of decompression. And we also use inertial extension. And the extension machine is you lay down on your back, you plug your hips in with these pegs, the whole table oscillates, and every time it hits headward, the spine subtly opens up. So it can also milk the nucleuses back to the center. So again, the treatment is a management issue, and it's not something you cure, because once the fibers around the disc are injured, they're permanently injured, and you can treat it and be feeling good, but because there's still weakening in the wall, you could sneeze or just bend wrong, and that you can end up having that re-herniation. But in time, the patient with the disc herniation will realize what they need to do as far as what they really need, what they shouldn't be doing, like they shouldn't be lifting, or they can't do certain physical activities because they know they're going to re-injure themselves. And they also learn what they need to do on a daily basis to keep themselves strong, which is like could be just some easy floor-based stretching and some strengthening exercises, which is how it's an educational process on how to treat the disc. So if you know someone with recurring symptoms, tell them about me. I'm Dr. Mike at Main Place Chiropractic. Good morning.
We got 1 minute for questions.
The table, what did you call it? The rack? Or
I know. Rack.
no, the inertial
Extension. Yeah.
extension. Is that new?
I've had it for 20 years.
Okay, it's not new.
No, it's old, but it's not too many people have it. I use it as an adjusting table. You can plug the hips in, and you can pull on the head and give it a little check. And just, it's wonderful. It's awesome.
I will give a testimonial to
Yeah,
that. That actually is really good. I mean, Dr. Mike did an adjustment on me, and then, I don't know, for some people they may get kind of, but for me it's great because I have neck issues and I felt it go all the way down my spine. I felt like almost everything adjusting. It went like that, and it was great. So I can't highly recommend Dr. Mike enough.
Have you ever had someone come in with like little pains and then from the adjustment it gets worse, or like just?
Yep. A lot of people, if their first week or two of adjustments can get worse, feeling worse, because when you start moving areas around that haven't moved, you're going to have a little more muscle soreness. It's more of a like you just worked out type of soreness. They don't come in the next day going. Generally, of course, I've had everything. In 20 years, you've seen it all. You know.
Question and a testimonial. The question: is there a difference between the machine and the manual, like you do, for the decompression?
You know, the manual stuff it's FDA approved. You can build insurance for it. The machine is not FDA approved, and you cannot build insurance for it because it's not a proven thing. And it's much more expensive.
Is it one better than the other?
I mean, it's just different. I think it's very effective. I think the machine, the ones you do with the harness and all that, I think they're very effective. But it's not the cure, and I think it's being marketed as a cure. And people they'll spend $5,000 to $8,000 thinking that's going to help them, and they end up having surgery anyhow.
Okay. And then the testimonial, I weightlift quite a bit, and I hurt my back quite a while ago, and I went to a chiropractor before I actually knew Dr. Mike, and the guy adjusted me, walked out of there with the same pain I had, didn't feel like he had done anything. Went to Dr. Mike because I was having pain later on. I walked out of there, I felt like $1 million.
So, baby,
you know,
what are you talking about?